Officially the first day of winter tomorrow, of course, but the seasons may change, but the difficulty of recruiting and retaining doctors in the island's health service does not, and it was highlighted yesterday in the House of Keys that the final sitting of the year, the Health Department member Jason Morehouse revealed at the sitting that 34 posts were vacant towards the end of November, 14 of those vacancies for consultants. Replying to a question from the ONCA member Julie Edge, Mr Morehouse said there were varying grades across Nobles Hospital currently affected.
The vacancies include 14 consultant posts. 6 of the junior doctor vacancies are as a consequence of a reduction in the number of doctors choosing to remain in continuing medical training, which resulted in the Isle of Man receiving a greatly diminished junior doctor allocation in August 2017 from Health Education England North West. This is not just a local problem and is affecting the majority of hospitals in the UK. 24 of the vacant posts are currently being covered by locum doctors, with the remaining vacancy balance being covered by bank doctors. As the Honourable Member will understand, the Department frontline professional staff provide essential services, and so such posts cannot be left vacant. Significant progress is being made to recruit to these vacancies, with 2 consultant posts already being filled. These are in gynaecology and paediatrics, with the successful candidates due to start work in January 2018 and March 2018 respectively. Interviews are currently being scheduled for the vacant consultant surgeon posts in specialities of breast and ENT. In addition, shortlisting is about to commence for 3 vacant consultant radiologist posts. The recruitment advert for 6 consultant posts has just closed. Of these 6 posts, 4 are new posts which have been created through converting middle grade doctor vacancies that at present are being covered through expensive locums. The respective cost of middle grade locums is greater than a substantive consultant salary. These middle grade posts will be disestablished once the consultant appointments have been made. It is perhaps worth noting that as part of the recent recruitment process, there was a significant number of strong applicants, a reflection of how positive Nobles is viewed by potential employees.
Supplementary question, Ms Edge.
Thank you, Mr Speaker, and thank you for the extensive response. But I did ask how many doctors are currently being paid for locum work.
Mr Morehouse.
Thank you, Mr Speaker. There are 6 salaried locum posts currently.
Supplementary question, Mr Baker.
Thank you, Mr Speaker. Does the Member for Health believe that the recruitment process that the Department is following is sufficient to actually address the issue, and is there room for improvement in the way that the Department is tackling that? And can he confirm that this is receiving the suitable degree of management and ministerial focus?
Member for Health and Social Care to reply.
Thank you, Mr Speaker. Yes, that is a priority. One of our key concerns is the time actually taken to fill these posts. From them becoming available to actually being completed, it's taking 6 months in many cases, which is an issue. But one of the pleasing aspects of what is happening is the number of applicants, and it's worth noting that of 2 of the recent interviews, there were 3 really strong candidates at interview from a significant number of applicants, and with the second there were 4, so we're actually having real choice of really strong candidates at the moment.
Of course, in the absence of the Health Minister, Kate Beecroft, it was down to Jason Morehouse and Anne Corlett, another departmental member, to answer particular questions. Well, joining me in the studio is the head of the Unite Union in the island, Eric Holmes. Good morning.
Good morning, James.
Tell me that the number of vacant doctors' posts is high. That's not a surprise in itself, but do those figures you've just heard surprise you?
Well, to be honest with you, James, Mr Morecroft has just delivered a very comprehensive brief that was just full of facts and figures that bear no relation to the real problem.
He's just passing on what he's been given, of course, Mr Morehouse.
Obviously he is, but unfortunately he doesn't have the background and the local knowledge and experience to know that this didn't happen overnight. This has been going on for many years. For the last 3 years, locums have ruled the roost at the hospital, and they're not prepared to take up full-time positions, and why would they? It's so lucrative to do what they're doing. They've formed a monopoly.
But if the island is such a desirable place as we're often told it is, why are so many staff either leaving or not coming across or not staying long? I mean, some of these are your members.
A lot of our members across the mid bands, mid to high bands, have sort of had enough because they don't have faith in the structure. And that's the main problem. There's no real faith in the management structure. It hasn't been for a long time.
But there does seem to be morale issues, no question about that, in certain areas. And in many ways, of course, the health, or a number of the health staff in the health service are the greatest asset, the greatest strength. So what's causing the problem?
Well, as I say, James, it's, the rot is caused from the top, and unfortunately it's fed down.
But in what ways?
Well, continually what we're seeing is the management structure feel that the terms and conditions of the lower grades beneath them are where they need to find the savings from. No, you need to sort out and grasp the nettle. The problem that you've got is that the locum doctors are abusing a system that they've established and have done for a long time, and that's been acknowledged by the management structure right through from the CEO himself, Dr. Couch. Sort that problem out first. That will take away most of your soak away. Most of that soak away is being caused deliberately by those at the top of the food chain. So there's nothing left for trickle down.
Well, only in October, the Health Minister, Kate Beecroft, said the overspend was largely down to the number of locums, agency staff, etc., working on the island. So it's known about it. How can it be avoided?
Well, first of all, you've got to try and break that cycle. And the fact that they've allowed it to go on for so long now and have just fed money into it is where they're going to have major difficulties. As has been said, and if you listen to the final reply when Julie Edge actually asked him to answer the question properly, he said that basically there was 6 or 7 locums that are still ruling the roost as such. That is where the problem lies, and if they don't realise that themselves as senior doctors and consultants, then that's where part of the major problem is.
By the sounds of it, they do realise it and they're trying to do something about it.
Well, the hospital has to do something about it because they cannot keep feeding that from the pay pockets of other people.
But equally, if there's not enough staff, certain frontline services have to be offered. You've got to pay the whack.
Yes, that's it. But that brings us back round to the whole nub of the whole problem then, doesn't it? The services that the people on the island expect and have been given for so long for the tax that is paid, that's where the problem lies. Government won't face that problem, will it?
Recruitment in the health sector is a global issue. I mean, we are fortunate in many ways, aren't we?
We certainly are, and the people that we have in the hospital they're actually giving a really good service. They're frustrated that they want to be able to deliver services, but are being held back in other areas.
Just finally, is there a solution to this problem in sight? There may be a bit of help here, a bit of help there, but this isn't going to change in a hurry.
Like I say, we've been having this argument and battle now for the last 3 or 4 years, so it may be new to the new incumbents who have now only been in for a year, but you know, they should be catching on by now where the problems lie.
Locums rule the roost, is that what you're saying?
Currently, that's the problem at the hospital. Locums rule the roost, and that was shown in the figures that when he finally answered the question.